Dr. Tom Roselle live right now, 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. I am live in studio, and we scored again. Another beautiful, beautiful Washington day. Hopefully you'll get outside and you relax. You get all that vitamin D stimulating your skin. Actually not, because this time of the year you don't get too much. But we're here to answer your questions on any topic that you have in mind, a problem that you've had, you've tried, you've applied, you've come up with the same old, same old. Guess what? A whole lot of nothing. Well, here's your opportunity. This is the place that I can answer your questions from a different point of view, meaning no drugs, no surgery. We're broadcasting to you from 105.9 FM and AM 630 WMAL. If you have a question on anything, whether we're on topic or not, 888-630-9625. That's 888-630-WMAL. Love to talk to you, really would. Give us a call. Have a fascinating topic, one that bothers many of you, one that causes all kinds of symptom presentations, from headaches to dizziness to facial pain, a very devastating condition called tic-Delarue or trigeminal neuralgia, which many people actually have gotten to the point where nobody's helped them and committed suicide. That's how severe it is. Bite that doesn't seem to be right, even tingling and numbness from your face to your toes to your nose. But, you know, more importantly, as we discuss this, I have a very, very special guest for you, someone who is an expert in this area, someone who I have tremendous amount of respect for, someone who we refer to on an ongoing basis, Dr. Michael Chung. Hello, Michael.
Oh, thank you. It's a pleasure to be here, and I'm very honored.
I'm glad that you're here because it's going to be fun. Dr. Chung is a dentist practicing in Oakton, Virginia, and his specialty is neuromuscular dentistry, or the ramifications, if you will, of the TMJ, the temporomandibular joint, and the dimension. When we talk about dimension, we're talking about the position of teeth to teeth and jaw to, to bone, and how it affects you neurologically and the symptoms that you have. And some of you have been suffering for many reasons, and we're going to explore that. Dr. Chung is undergraduate of Johns Hopkins. He did his dental training in the University of Maryland School of Dental Surgery. He spent 3 years in the Navy as a dentist and had been in practice for 20 years. Postgraduate work at Las Vegas Institute, which specializes in the subject that we're talking about. So we're going to talk a little bit about that today. And before I get into that, I want to remind many of you that last week we had an in-office continuing education program on acid-alkaline applications, what happens when your body gets too acid, the pain patterns that don't go away no matter what kind of care that you have, and why your body must stay alkaline, why it was designed to be alkaline. Well, guess what? We had a full house, and we had such an overflow. We're going to redo that class again this week, December the 7th at 7:30 p.m. at the Roselle Center for Healing. I'm going to be your presenter. I'd love to have you. Please be my guest. If you'd like to attend, call our office at 703-698-7117. That's 703-698-7117. And I'd love to see you this Wednesday night. Call my staff. Remember, we do sell out, but we do require a reservation, so I'd love to have you there. But let's talk about temporomandibular joint problems, Dr. Chung, and, why there's such a devastating and far-reaching, much more so, I think, than most people would really begin to think about, even most physicians, that TMJ, that hinge on our jawline, we call it lovingly the pump handle of the skull, because it helps move spinal fluid function and so forth. Talk to me a little bit about that. Why is this such a serious problem? And let's talk a little bit about the symptoms.
Well, it's very serious, first of all, because probably about 40 million people in this country is suffering from it. And most of them go undiagnosed or misdiagnosed. Many patients have been to many physicians and many different doctors and many specialists and have found no relief. And a lot of times it can be just be TMD that's causing all these symptoms, and that can be anything from headaches to popping and jaw clicking and any kind of facial pain. And sensitive teeth, even pain in the neck or down the shoulders, and it will affect the other parts of their skeletal system.
I know I've sent you many patients, and our working together has been phenomenal, because we've had patients who we've taken to a certain point, we can't get them across the threshold, but we know that they've got another problem. That problem often turns out to be a a problem with the teeth and the jaw not sitting properly. For example, I have patients who go into what we call spasmodic torticollis, where the neck is called wry neck as well, where the neck continues to spasm to one side. And it's often a TMJ problem. And the evidence is that you correct the TMJ and that muscle spasm goes away.
Yes. Well, the way our body and our jaw and our teeth were designed is that your jaw is basically slung by a bunch of different muscles of your face and neck area, and they're designed to be relaxed when you're not chewing or swallowing. And in patients that have that misaligned, your muscles can constantly be in a spastic mode, trying to accommodate for that bad positioning. So, and when that is out of alignment, the adjustments that you do for your neck and get the patient out of pain may not hold as well. We see that all the time. There's an interesting story. I think I told you about this. I write about it in my book, Ageless Health. Health is a Do-It-Yourself program. There's a young girl. She was about 11 years old. And this goes back a whole lot of years ago, when I think I was in practice about 2 years. And her whole family came in to see me about once a month to maintain good structural balance. We did some acupuncture and so forth. And here's this young girl, gymnast, squared, solid. And what she was doing, when she left my office that day, she was going to go to her dentist and she was going to have orthodontia. She was going to have braces put on. And in those days, it wasn't the social acceptance that we see today. So she was going to go to her grandmother's house for the summer. So the dentist put on the braces, knowing that he wouldn't see her for probably 7 weeks, decided to tighten them down a little bit more than he normally would, and told her, you can probably have some discomfort. Here's a prescription. I'll see you when you get back. So I don't see this girl now till September. She comes in, and this was a girl with a perfectly solid body. Now I'm looking at a young girl who has a 22 to 23 degree curvature in her spine, and that abnormal shifting. So I called a friend of mine, a guy by the name of Mike Marfino, who was associate professor of dentistry at University of Buffalo. Mike was an applied kinesiologist, our specialty, and Mike starts laughing at me, and he says, listen, you know what happened? He said every tooth in the body has a relationship to other systems. He said, send her over, I'll take the braces off between the two of us. And fortunately, thank God, within 100 days, we had her spine straight again. Wonderful, yes.
Have you seen that type of structural aberration, not from putting braces on badly, but from other types of, I'll call it bad dentistry. I know you don't want to strike out at anybody, but, sure. Bad implants, vertical dimensions, the heights that haven't been appropriate?
Well, our whole occlusal system is so sensitive. Like you said, even just a bad bite on one filling could throw off the whole system and cause pain. So being that sensitive, it is obviously extremely important that we put the patient back into correct, equilibrated, balanced neuromuscular system. So typically when you go to an orthodontist or a general dentist, they're fixing your tooth or straightening your tooth to your habitual bite. That's assuming that you're in the correct bite position. And a lot of times when you do this and maybe even bring their jaw further back or cause a little more distortion in their joint, it can put them in severe, severe pain. And that's what it seems like probably happened to this young girl. Here's a question. Patient goes in to see a dentist, and they do a filling, or they do a crown, or they implant. And when they're all done, the patient's laying there on their back, and the dentist takes out that little piece of carbon paper, right? That's right.
And puts it in and says, tap on this. And the patient goes like that and taps on the carbon paper. And they say, okay, we got a little high spot here, and they zip, 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 and they take away the high spot. How does that feel? And they say, well, it feels good. Why is that technique not appropriate? Why does it cause more problems than what it solves?
Yes. Well, that's exactly what's done in a general dentist's office. And the problem with that is that when you're laying back, just from the gravity, and as we said, the lower jaw is slung by muscles, and it's not a fixed position. And that position, the patient's bite is totally different than if they're sitting up on a nice level to the ground. If they lean their head to their left or to their right and to tap on their teeth, they'll realize that they're hitting on a different spot even then. So if you go to a good neuromuscular dentist, they will always balance your occlusion on a nice level, your eyes level to the ground.
Dr. Michael Chung is my guest in studio today. We're talking about temporomandibular joint problems, neuromuscular dentistry, and why sometimes getting your teeth fixed can do more damage, and how you can actually turn this around. We're going to talk about that in the next half. Dr. Chung is located in Oakton, Virginia. You can go to his website at softtouchdentalcare.com, and that's soft touch with one T. He leaves out the second, so guys like me don't mess it up. softtouchdentalcare.com in Oakton, Virginia. Michael, before we continue the process, we've got several calls lining up. I want to go to at least take one of them. Laura, how can I help you?
Hi, Dr. Roselle. Thanks for taking my call. I'm calling because my granddaughter is giving her mom a hard time. She doesn't eat the fruits or vegetables, and she wants to eat only like cakes and sweets and fast food. Her mom doesn't let her do that. So we are really concerned about her health because she's not getting the right nutrients.
Well, you should be concerned about her health because how old is your granddaughter?
She's 8 years old.
Okay, so the first thing that you do is, one, you make sure that there is no junk in the house, period. Get it out, not even for anyone. Everybody's going to have to tighten up on this one. It can't even be available. The only things that can be available are good-for-you foods. And the other thing, you can talk to my daughter or even my wife, and they'll tell you how to put together protein shakes that you can disguise things in to begin to get her the nutrients that she needs to have. You can put in spirulina, you can put in a lot of the green grasses and so forth and start getting her, but you must also give her a really good multiple vitamin to begin to balance the deficits out. But it's a problem, but the whole family has to pitch in on this one. You can't have anything except for food, and she can't have, good food, and she can't say, I'm not going to eat. Fine, if you're not going to eat, you're not going to eat, but you're not going to have anything else for dinner. Sooner or later, you'll find that it'll begin to change. We used to have a 3-bite rule in my house. Whatever was on the table, even if you didn't like it, you had to have 3 bites. Even if they were small bites, you had to taste it, and that was that. Otherwise, you get to sit there all night long. But that was me. A lot of parents aren't willing to do that. I didn't care about the tears or anything else. So I have 2 children today and grandchildren that virtually eat, at least they'll taste everything. But you can give Sue a call. She can tell you how to disguise the stuff. You can make an appointment, to bring your granddaughter or your daughter in and see what you can do to get this thing fixed. But first step is get rid of everything that's in the house.
Yeah, she doesn't have any junk food. Her mom is very, very aware of that, and she doesn't allow her to do that. But she could stay without eating anything, just for the fact, I don't like that. I don't like that.
Yeah, it's a war of wills. So
yeah, and she did that. She tried this by putting some stuff in the shakes or the smoothies. But once she tastes it, she could tell.
Well,
Can you believe it?
Well, she can, but there's ways of doing it gently, a little bit at a time. So my daughter does it with her son and her baby. She gives them smoothies. Laura, but give us a call. We'll be more than happy to tell you how to disguise it. It's not that difficult, and if you do it step by step, and you control it, things will change.
Dr. Tom Roselle Live continues now. 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We are in studio. 888-630-9625. 888-630-WMAL. That's how you talk to me. And Dr. Michael Chung, who's my guest in studio. We're talking about temporomandibular joint dysfunction, TMD, or TMJ, for those of you who want to talk about temporomandibular joint. But the problems are the same: pain, spasm, dizziness, muscle contraction, even scoliosis, as we talked about a little while ago, perceptions of hot and cold differentiations, headaches, and the list goes on. It's quite important. And some of you end up with this after you've had extensive dental work. You've had bridges and crowns and implants. You've had the dentist go in and zip the wrong way, and it's never been right, and you haven't gone back because you don't have the time. Well, we're going to clear the playing field on all that today and tell you why it's so important, so critical that you have someone who is competent doing this work. We refer to Dr. Michael Chung. He's in Oakton. Soft Touch Dental Care is his office. Matter of fact, you go to softtouchdentalcare.com, 1T, COFTOUCH, dentalcare.com, and look him up, check him out. He is a graduate of the University of Maryland School of Dental Surgery, spent 3 years in the Navy as a dentist, and has been in practice for 20 years. Dr. Chung, let's talk a little bit more about the cycle of this problem. What happens over time? Let's take an example. A patient goes in and they have some work done. They have braces put on.
Yes.
All right? So they have orthotics as an adult. Today, more adults are having either Invisaligns and Regulate and so forth. So all of a sudden, the patient starts having spasm. They start having headaches. Their mouth doesn't fit the way it was supposed to originally, and they say, I should have never done this. What's going on?
Well, our system is so sensitive that, I don't know if you've ever were eating and had a small piece of sand in your mouth, and it just feels like your whole jaw is going to break. Well, it's that sensitive. It doesn't have to be off by much, and each one of us has a tolerance level we can accommodate to a certain point, but once we go beyond that, we could go into a severe cycle of pain. And in some of these cases, where the patient's habitual bite was probably not in the optimum position to start with, and any dental work that's done to change that may totally set them off on the wrong way. And usually their jaw is sliding even further back, and their joints are being pushed back, and their muscles are having to accommodate even more. I think analogous to if you were walking down the street and you had stone on one of your shoes. Well, you would have to accommodate and walk funny because one side of your foot would hurt otherwise. And eventually you'll start having pain in other parts of your body, such as your hip and everything else. So, and it becomes a constant vicious cycle.
Here's a question for you. I have a slight crossbite.
Yes.
Which you know.
Yes.
Because I come see you. And so my question is, can that crossbite, and I'm sure many of our listeners have been told they have a crossbite and let's watch it or whatever.
Yes.
Can that crossbite come about as a result of obviously trauma and imbalance? And we see it in our business when the spinal system is misaligned, and a lot of crossbites we can correct. But can it come as a result of the misapplication of dentistry?
I think crossbites are usually more probably started out genetic and possibly during development. What happens, the way teeth line up, is basically a balance between the tongue muscle on the inside and your cheek and your lip muscles on the outside. And there's a fine balance there that if everything is great and equilibrated, then your teeth are lined up nice and straight. Well, some patients will have usually some form of tongue habit when they're growing up, or they may have some airway obstructions that may cause them to be a mouth breather. And you will see a lot of times in those kind of patients open bite. Their front teeth won't touch because their tongue will get in the way, and they'll use their tongue to brace themselves as they swallow, or they'll be breathing through their mouth. So there's a big imbalance of muscle equilibration there, and the tongue is causing that. So, and that can sometimes cause crossbite as well.
So you have a patient who has, and we're going to use your terms, it's genetic, it's something that they have a predisposition.
Yes.
So can that be corrected?
Yes, absolutely. Even probably 10 years ago, there were a lot of guessing, but now today, there's a very sophisticated computer system called the K7 that we use very objectively to be able to measure and put everything back into balance, which is, we're talking about the positioning of your TMJ, all the muscles of your head and neck that controls and your chewing and swallowing and all those things, and we can put that back into correct balance, yes.
And we're going to talk about that because the K7 is a fascinating piece of examination and equipment, and it really shows you what's going on right on the spot and what you have to do to correct it, and not only what you need to do to correct it. Now, I may be misguiding people, but more importantly, once it's corrected, is it corrected? Is it done? Is it really working the way it's supposed to?
Well, the patient can tell you that, first of all, because a lot of patients come to see me because they're already having pain and lots of these symptoms that we talked about. Now, what we do usually after we find out where their positioning should be ideally on the computer, we give them a provisional orthotic. So it's totally temporary and not permanent. So we can relieve all those symptoms or make sure the patient knows and understands that all these symptoms are gone before we do anything permanent.
Dr. Tom Roselle Live continues now. 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We are in studio broadcasting to you from 105.9 FM and AM 630 WMAL. Love to talk to you. 888-630-9625. That's 888-630-WMAL. That's how you find me here. And if you'd like to find us off the air, go to rosellecare.com. That's ROSELLECARE. But more importantly, if you'd like to check out old programs, go to roselleradio.com. And all of these programs are lined up for your re-listening pleasure. This Wednesday evening, the 7th of December at 7:30 p.m., we're going to do number 2 in acid alkaline diet. Number 2 meaning there's many of you that didn't have the opportunity to attend last week's lecture because we were full house. And I will be your presenter. I will be your host. Please join me. Give my office a call at 703-698-7117. That's 703-698-7117. Tell my staff you'd like to attend this Wednesday night's lecture on acid alkaline diet. Actually, acid alkaline systems and why acidity in your body causes pain and why things don't go away even though that you've been treated and how it should be evaluated and what you need to do. And it's a straight-up presentation. I'm sure that you're going to enjoy it. My guest in studio, Dr. Michael Chung, dentist in Oakton, Virginia, graduate of University of Maryland School of Dentistry, 3 years in the Navy, practiced for 20 years, specialist in neuromuscular dentistry, one of the brightest that I've had the pleasure of meeting. We're back. So let's talk again. We mentioned a little bit. There's one question. We have several callers lining up right now, and there's one call I want to take. But what I want to start talking about is that case 7, because that's amazing to me. Jane, thank you for waiting so long. I appreciate it. How can we help you?
Yes, I'm trying to find out what type of a dentist would be the best type for me to see. I have a broken tooth. I fell and broke a tooth, and I don't know, that needs to be repaired. Also, some fillings.
Okay, so you have a broken tooth, you have some fillings. All of that adds up to your mouth is not closing the way it's supposed to, and you may be getting some bone loss. Having said that, I'm going to let Dr. Chung answer that question for you and where you should go. I'm going to tell you to go see him, but nevertheless, I'm going to let him tell you how to evaluate somebody.
Yeah.
Well, I mean, the fact that you're having so many breakages of teeth...
well, I fell and broke, it's just one that's broken.
Okay, just one. And are you having any other symptoms? Are you having any hot and cold sensitivity in any of your teeth? Or?
Well, I need a filling, I think, also in the back.
I see.
Yeah.
Okay. And have you had much dental work before?
Yeah, I have had caps many years ago.
And you haven't had any problems since?
They're just fillings occasionally.
Okay. Well, I mean, it sounds like to me that you just may need to have some general dentistry done, and you may be just some of the patients that do just fine, and you may adapt just well to that, your habitual bite that you have now. But if you do have problems after that, or if you have any other signs of TMD, then you may need to seek a neuromuscular dentist who can actually put all those things back in balance for you, not just your teeth.
Jane, the interesting thing is Dr. Chung is also just not a neuromuscular dentist, which is his area of specialization, but he does across-the-board general dentistry. And he would be my choice because I know the quality of his work, and obviously that's who we refer to.
Mm-hmm. But the only problem is he's a little ways out, so...
Yeah, he's probably about 10 minutes from you. If you get on 66 on Arlington and hop up there.
Drive.
Oh, then you got a problem. Then what I'll tell you to do is to call his office, and he will make a referral for you.
Oh, that would be great.
Okay, so he'll tell you who's in your area that you should see. Now, for the other thing, and I twisted Dr. Chung's arm to do this. He's a very busy guy, and I don't know how he's going to get this done, but I told him he couldn't come on my program unless he was willing to do something for my audience. Dr. Chung is extending to anybody that would like to talk to him a courtesy consultation in his office, no charge. He'll come in, he'll talk to you, he'll tell you, what steps you should take. Limited consultation at absolutely no charge to you. All you need to do is get a hold of him at Soft Touch Dental Care, or give his office a call. You can find his phone number. He's in Oakton, Virginia, right very close to the 12366 exit, and he'll be more than happy to help everybody out. See, I told you I was going to stick you. You got to see these people, okay? we're talking about things, and you got to make sure that you evaluate them.
I would be happy to help.
Okay, good. So let's talk about K7. We got more phone calls, and I want to get to them, but this is important. Let's talk about the K7 and what it really is and what it evaluates.
Sure. Like we mentioned earlier, the K7 is a very sophisticated computer system that was developed because our human eye just cannot see the minor movements or see the inner structures of the human anatomy. And what it can do is find out, which muscles in the head and neck system are not working properly, which are not functioning efficiently. And we can also measure the little movements, tiny movements of the mandible in different biting positions and chewing patterns. We also use sonography to be able to hear any kind of noises that are caused by vibrations or just the rubbing of the joints in all different opening and closing positions, and which gives us a lot of information to be able to equilibrate the whole system back to normal.
This is very cool stuff. It's like space age stuff. You walk in and he's got all these things stuck on your head, and he's knocking. What they're doing is it's a TENS unit initially, and he's tapping and he's knocking muscles out. Then he has you open and close your mouth while you're hooked up to all these computer electrodes. And up on the screen, you see all of these lines that go off skew. And they go off skew if your mouth is not closing properly, and when your mouth is in position the way it's supposed to be, all the lines are where they're supposed to be. It's amazing stuff.
Correct. Yes.
So you know whether you did it.
I wouldn't be able to practice today without it anymore.
Yeah. Well,
it is a great system.
Not as accurately as you do. and you do amazing neck and fast. Wow, you do good stuff.
Thank you.
Let's go to the phones. Linda, how can I help you? Thank you for calling.
Hi, doctor. I would like to ask you, thinking about coming to your office for hypothyroidism, and I now take Armour Thyroid, but it's really impossible to be properly diagnosed by a regular conventional doctor as far as how good the function is of your thyroid gland, because they usually give you the blood tests, the lab tests that are not accurate. So I was wondering if, in your office, do you give a particular kind of test for thyroid?
We do all kinds of things, Linda. It's the thyroid is one of those organ systems that is not a standalone organ, although it has tremendous ramifications throughout the entire system.
Right.
It stimulates hormone release. It allows neuromuscular work to function properly. It causes cognitive patterns to be balanced, and so forth and so on. We could spend the whole program on it, obviously. But we do two things. We specialize in an area of practice called applied kinesiology, and where we recognize the relationship neurologically between organ systems and muscle function. So we're going to do neuromuscular, our way of doing neuromuscular testing, doing manual muscle testing, and we do things with allergy testing, and we do things with temperature gradients and so forth. But then we're going to refer out and we're going to get the blood work. Now, it's important that you get all the blood work done. Unfortunately, most physicians only do TSH, thyroid stimulating hormone. Maybe you can get them to do a T4, which is thyroxine. But that's just the beginning. The pituitary produces TSH. The thyroid, if it's working properly or can work properly in the presence of several different things, tyrosine, trace minerals, iodine, will produce thyroxine, which is T4. And then it will then be converted in the liver. The T4 is converted to T3, and then you have to know how much of it's available to transport. You have to know if it's being taken up. But then you need to know if there's something called reverse T3 that's shutting down that production, and you need to also know whether or not there are autoimmune antibody reactions to the hormone itself. And even though that Armour is a good substance, and it would be my choice if you have to go on something because your thyroid just won't work and won't work on any circumstances, you can become autoimmune sensitive to the cell tissue. So there's steps that have to be done properly. But that's if we had more time today in the program, I'd get into it much more in depth, but that's what we do. And then treatment is around, depends on what we find. It can be a combination of neuromuscular balance, acupuncture. It can be nutritional. It can be a combination generally of all of those things. So if I can be of further help, Linda, please give me a call, get a hold of me online, or come in and make an appointment. I appreciate your phone call. Dr. Chung, back to what we're doing. Dr. Chung is a dentist in Oakton, Virginia, and his phone number, if you'd like to talk to him, is 888-SOFT-TOUCH, SOFTOUCH, and you can get a hold of him, or 703-319-6990, or you go to his website at softtouchdentalcare.com. Dr. Chung is offering all of Dr. Tom Roselle's listeners a courtesy consultation if you think you're having TMJ problems, or if you're dizzy, if you got pain that just doesn't go away in the head, neck, and shoulder area, if your mouth is clicking, and even if you're having problems with sleep apnea. We talked about that a little earlier because the TMJ can cause sleep apnea conditions. You want to talk about that a little bit?
Yes, there's a strong relationship between the oral cavity and the nasal cavity. Basically, oral cavity is the ending of the nasal cavity. They connect. And if you have any kind of airway issues, it can cause basically malocclusion, and malocclusion can cause TMD, which in turn can cause sleep apnea and other kind of airway issues.
So, when most dentists look at this, and most physicians look at this as a failure of the glossopharyngeal nerve and the upper soft palate, and it just doesn't move out of the way, it folds back on itself, so the patient stops breathing. And we know in our practice that a lot of it has to do with the occiput, upper cervical area, and when we balance the nerves, often we can restore tone and function. But so often, it is a dental issue. It is a result of that TMJ and how it affects the upper cervical spine and how it affects the occiput. And we see that. So how do you treat a patient like that? I mean, you got a lot of people out there that don't like their CPAPs. They don't want to be on them. They can't stand them. They make them feel bad. What do you do?
Well, I mean, it's certainly they still should have their sleep study done, and if they are strongly recommended to have a CPAP machine, they should try to work with that. Now, there are certain, population that will not wear a CPAP, or at least not to the extent, to the level that they want them to use it at. On those patients, we can make them an orthotic appliance that can actually reposition their jaw and their muscle structure so that they will have a better airway with less obstruction. They can usually get a much better flow of oxygen and can usually turn down their CPAP machine and in some cases not have to wear it at all.
That's a benefit to so many people. I know there's patients of ours that we've done a lot of work with them and they've gotten better, but they still go into a stress mode. And what we find is a lot of them are clenchers or grinders, or they're under a tremendous amount of stress all the time, or they're allergic reaction patients. And as we're working with them, we want to try to maintain that. And I know it works because I've seen you do it. So if you have a problem, obviously give Dr. Chung a call, and he can tell you it's something that can be helped or something that can't be helped. But we're talking about neuromuscular dentistry. We're talking about his specialty, and although he does all kinds of other work, and general dentistry included, you get a hold of him at 888-SOFT-TOUCH, or give him a call at his office at 703-319-6990. Get a hold of him online at Soft Dental Care. Let's talk a little bit more about the balance, the equilibration, if you will, meaning the vertical dimension, how the upper jaw and the lower jaw come together. It has to be perfect.
Oh, absolutely. It has to be perfect. We have what's called a proprioception. Your brain knows exactly how your teeth come together and will go there each time. It's extremely accurate and probably to within hundredth of a millimeter. But what happens a lot of times is that if your habitual bite is not in the correct position, then your muscles will still move your jaw to make your teeth meet together because they need to. That's how you chew and that's how you swallow. But it will have to accommodate for that. And eventually these muscles will get very tired and will build up lactic acid and will not get enough oxygenation and blood flow there, and eventually it cause lots of symptoms.
Dr. Tom Roselle Live continues now. 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We've been here at 888-630-WMAL, as we are every Sunday at 12 noon, bringing you the most up-to-date information in integrative and alternative health care. My guest in studio has been Dr. Michael Chung, 20 years in practice, Oakton, Virginia, 3 years in the Navy. One of the best neuromuscular guys out there, understands temporomandibular joint and why your mouth works the way it's supposed to, but does all types of great form of dentistry, is from removing amalgams, and has a full shop there. You can get a hold of Dr. Chung at I made that mistake and he corrected me, at 866 Soft Touch, SOFTOUCH, 866 SOFTOUCH, or you can go to his website at softtouchdentalcare.com. Remember, that's one T, SOFTOUCH, dentalcare.com. And Dr. Chung has graciously said that he would do a courtesy consultation for anybody that would like to come in and see him off the radio program. So when you call him, tell him you heard it on Dr. Tom Roselle Live, and he will allow you to come in and do a courtesy dental evaluation, and you can check him out and see if you like him. He's got a great place. It's like space age. I think that you'll really enjoy it. His staff is wonderful. They're some of the most pleasant people you're ever going to meet. But give him a call, 866-SOFTOUCH, and tell him that you heard it here, and that's why you're coming in to see him. Let's continue the process, my friend, and let's talk about the process of evaluation and, what really what you need to look at when you're looking at a patient. So many people say it hurts here, they drill there, they fix that. Tell me about it.
Sure. Well, it's very important to have a thorough evaluation done. Not only do you want to do a nice, thorough neuromuscular skeletal exam, but we also need to be able to have the right equipment to be able to see everything. And we talked earlier about the K7 program that can actually analyze the muscles, the joint, and the precise the bite that we need to find. But we also take a cone beam, which is a tomogram. It's a three-dimensional picture of the whole head and neck area, and we can see everything in slice pictures and be able to find out and put everything back into balance.
So when you get a patient, you start dealing with them, and you know that there's a distortion pattern, you know they've had a problem, and you can really bring their life back. You can bring them back to a place where they may not have appreciated good health in many years.
Yes, we have so many patients that have been through every specialist, have usually come to us as a last resort. They usually go to ENTs and have CAT scans done to rule out any kind of cancer or tumor, and they almost have given up, and they come to us as a last resort and find out it was TMD all along, and it certainly can change your life.
Temporomandibular joint dysfunction, that hinge that when you open and close your mouth has huge, huge ramifications to your entire health. It's one that if it's not stable, if it's not corrected properly, particularly if you're a grinder, you're a clencher like I am, you can destroy your teeth. You can destroy your health because of that, and chronic pain patterns. You come in to see me and I tell you that, your upper spine is out of position, it's subluxated, it's doing this, and we get correction, but we don't get more than 80-85%, better than you were. But here's a situation that if it's related to the TMJ, and it's because of bad vertical dimension, this is something that you can get corrected. But any kind of dental work, this guy is, in my book, and I only refer to the best, is top notch. Get a hold of Dr. Chung at 866-SOFTOUCH. Or go online, leave him a note at softtouchdentalcare.com, and he is willing to give you a courtesy consultation. In addition to that, I want to remind you, this Wednesday, December the 7th, 7:30 p.m., I'm going to revisit acid-alkaline metabolism and diet. So if you'd like to join me, please be my guest. Call my office at 703-698-7117. You've been listening to Dr. Tom Roselle Live. Sorry we didn't get to all of you online. We'll do it again next week. See you then. This is Dr. Tom Roselle.